And to present the webinar, we have a friend and customer, Peter Kim. He practices at North Shore Dental in Auckland. He's a Hulaser expert and user. By the way, Peter, thank you very much for accepting the invite. Thanks in advance for sharing your knowledge with the colleagues here.
No worries. Thanks for having me here, and hopefully I can be of some assistance to some of you guys.
You will, yes.
Okay, so I work in Auckland in Browns Bay at a place called North Shore Dental. We're a fairly big practice. We've got about 8 dentists working there. And I've been up here for about, this is my 5th year coming up. And yeah, I invested in the K2 laser through John. I think it was around sometime last year. I actually found out about it online because I was in the market for getting a diode laser, and I didn't realize that there was a distributor here. So fortunately, me and John go a while back, so I got in touch with them, and things have been obviously really smooth. Obviously excellent customer service, and they're really approachable, and they're quite responsive. So obviously those things, I'm speaking for myself as a clinician, but I'm sure a lot of you guys here tonight will appreciate that as well. Look, if there's any issues, they're onto it, and they'll respond very quickly for you. And so I guess I'll just talk a little bit about some basic history of lasers, and obviously we'll talk a little bit about the K2 laser, and I'll try and share some clinical tips and scenarios of my experience using it. So one of the first things that I learned, I didn't realize that laser is actually an acronym, and it stands for light amplification by stimulated emission of radiation. And to be specific, it's an electromagnetic radiation, and I'll touch base on that a little bit later on as well. But I mean, if you're technically inclined, this is sort of a more technical definition, but in a much simpler term, it just means that we can produce a very intense light source with the laser. And look, full disclaimer, I'm not an academic. I'm just a wet-fingered dentist, and I kindly accepted the offer to come and share my thoughts of using this laser. So much of my presentation is going to be talking about more the practical application of the laser rather than the nitty-gritty science behind it. But I would strongly recommend going to a proper hands-on course. I was fortunate to go and study with Professor Laurie Walsh in Australia a few years ago. And obviously, for those who know, we've got our very own Dr. Hisham Abdallah, who's based in Auckland, and they're both very knowledgeable in the laser field. And I'm actually waiting for the COVID thing to sort of settle down so I can go to one of Hisham's courses as well. But I know that in the past, in his social media, he speaks very highly of the K2 laser as well. So in terms of a general broad classification of lasers, there's actually many different types. Class 1 lasers, they have no biological, I guess, hazards, because the actual laser compartment's completely sealed off when it's in operation. So think of like your CD players, your DVD players, and laser printers. So they all use laser technology as well. Class 2 lasers, like your small laser pointers, they're devices that can emit up to a certain milliwatt of power output, and these also are safe in that they have no sort of damage to skin or burning things. And with the smaller type of pen, that kind of style of laser pointer, just our blinking reflex alone obviously closes our eyes, and that limits the damage by itself. But obviously if you stare at it with your eyes wide open for long periods of times, then it can be harmful to the eyes. But if you use it properly, then it's safe to use. A class 3R laser, it's just a much stronger and bigger laser pointer. It's because under certain conditions they can actually produce like a spot blindness. So think about if you look directly into the sun, everything turns very bright and your vision takes a while to come back. So it's very similar. And in some countries like DIT-USA, it's treated as a weapon, and if you're caught firing one of these lasers into aircrafts, it's a heavy fine or jail time. So we're getting into the more sort of heavy duty class lasers. The class 3B lasers, they are the ones that can sort of emit up to about 0.5 watts of power. And these are definitely an eye hazard, and skin can be burnt as well at higher levels. But think of things like at physiotherapists or chiropractors and beauticians, they use laser therapy to help exfoliate the skin and whatnot. But I guess what we're all interested in is these class 4 lasers. They're classified as any device that emit more than 0.5 watts of power. And they can obviously cause damage to the eye, but also burn materials on contact, including the skin. And it's important to note that the reflected beam of the laser is just as dangerous as the primary beam. And you'll see that in a little wee while. So I said we'll talk about electromagnetic spectrum. So electromagnetic radiation is a form of I guess energy that's all around us, and you can see on this diagram that in the middle we have the visible light spectrum, so our rainbow colors, Roy G. Biv, that ranges from 380 to 700 nanometers, and it's only a very, very small portion of the electromagnetic spectrum. And for us as dentists, we're obviously familiar with the ionizing radiation, such as our X-rays and cone beam CBCT machines. And then on the other end of the spectrum, we have our non-ionizing radiation. And the diode lasers, which I'm going to talk about tonight, fall just outside that visible spectrum at around 800 to 1,000 nanometers. So the lasers are on the non-ionizing side, meaning that it can't damage the DNA no matter how much we use it. But then why are lasers hazardous? It's because the beam can be focused into a very, very tiny spot, which causes intense effects that, like I suggested before, that can be direct or scattered or reflected radiation. And I think it's fair to say, you don't need to be an optometrist to realize that there's something wrong with the retina in that photo. And that photo is taken from a site where it said that this damage was induced from a laser. So we have to be very careful when using these. There's many different types of different lasers depending on what medium the laser is using. So the first question you have to ask yourself is what you actually want to achieve with using laser dentistry. Is it that you want to be able to cut hard tissue like enamel, dentin, or bone, or soft tissue, or both? And so today I'm talking about diode lasers, the semiconductors. And so like Raf said, they're becoming more popular in recent times, and I think around the world there's a big trend for lasers. And I'll highlight some of the uses for these as we go along. But if you're expecting to use this laser to cut teeth and bone and things, then I'll save you the hassle and let you know, unfortunately, this isn't the right webinar or the right product for you. But as a soft tissue laser, that's where it shines. So as you can see, it's quite extensive in terms of what you can actually achieve with a soft tissue diode laser. And I'll be the first to admit I don't use it for all the indications that it can do. My go-to for using the K2 laser is minor soft tissue surgery during restorative and implant sort of work. I am yet to sort of explore the endodontic applications and the bottom two, which is the photobiomodulation or the photothermal whitening. But it's there, and it's something that that's the thing I like about this laser, is that there's so many other things that I need to learn more about, and that's why I want to go to Hisham's course and other courses like this. So probably the last little bit of science for you here. What this graph shows, it's on the left-hand side, you've got the absorption coefficient, and it shows that different tissues respond differently to different wavelengths of the laser. And you can see in the middle there where it says 810, 940, 980, and 1064. Those are the diode lasers. And if you follow that graph up, it doesn't it's not very well absorbed in water, which is in the blue line, nor in the enamel, which is the black line, but there's actually quite good absorption in hemoglobin and melanin, and that's why it works so well on soft tissue. So this ties us back to that first question, what do you want to get out of your laser? And so if you use this graph, you can visually see that if you're trying to cut soft tissue with, say, for example, erbium laser, which is on the right hand side of the scale, you're going to get a lot more bleeding because the hemoglobin doesn't respond or doesn't absorb as well as the soft tissue wavelength. What you can see here is that at different temperatures, as you increase the power output of the tip, you get different sort of reactions. So at a very low level, and we're talking like a 0.1 wattage, it warms up the temperature of the tissue where you point your laser at to about 40 to 50 degrees, and this warmth actually increases circulation, and that allows for improved healing speeds, and that's the whole photo biomodulation thing I was talking about, or low level laser therapy. As you increase the temperature upwards to 60 degrees, you start getting coagulation of the tissues, and that's what we want when we're wanting to get hemostasis or control the bleeding. And if we go even higher, that's when you get the tissues, they sort of melt over each other, sort of like suturing it together to promote better healing. And the power wattage is around 0.5 watts for this. And then slightly higher than that, you can see that we're up into that 100 degrees. And so that's where we get tissue ablation without any of the negative effects. So that's sort of like the sweet spot that we're trying to look for with the laser. And if we go even higher, upwards of like 200 degrees, then you notice that we get this thing called carbonization. That's basically charring of the tissues, and it looks very, very black. And that's something that we want to avoid, because that means that either the energy setting is too high or you're moving the laser too slow. And so hopefully that will make a little bit more sense as we go on. So obviously the lasers, like I said, are becoming more popular because of various different reasons. But basically the important thing that I like is that we can have really good hemostatic control. So we don't have to fiddle around with astringent or chemicals or retraction cord or anything like that. It's done, zap, and the bleeding stopped almost immediately. And there's plenty of studies. I mean, like I told you, I'm not an academic, but I've seen plenty of studies that show that wounds actually heal better and faster when using a laser as compared to a traditional scalpel blade. And it reduces the incidence of post-operative infection as well. And similarly, you get decreased swelling and things like that, and scarring. And overall, I guess this is a bit of a debatable point, but it promotes reduced surgery time as well. But you could argue someone who's not very surgically capable with a laser will be much slower than someone who's very capable with a blade. So take that with a pinch of salt. So in terms of the lasers, we know now that they generate energy in the form of light energy, and that's going to be absorbed by whatever the substance we cast that light onto. And so these are some of the considerations that we need to be thinking about in terms of what we want to achieve with the laser. The wavelengths ranges from 800 to 1,000 nanometers, depending on different manufacturers, and that'll all have slightly different effects, as you'll see from that graph before. But to be honest, from my personal experience, I haven't found a very, very big difference. So I'll show you the laser that I used to use in the past, and that's around 800 nanometers, and this K2 laser's 980. And look, I find that it's clinically probably not so relevant. But I'm happy to be proven wrong, but I may be using it incorrectly, but that's sort of anecdotally what I found. They're both just as effective, but there are a lot of advantages about the K2, which I'll talk to you about in a second. Obviously the amount of energy output, pretty self-explanatory, I hope. So the more energy, obviously the more effect. The mode used, that means that you can use the laser in a couple of different methods. There's a continuous mode, meaning that the laser beam is firing constantly at a given power outage. Pulsed means that you have gaps in between it, so it's like a tap, 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 and in between every tap, there's a little space that allows the tissue and the laser to cool as well. And there are some advantages of using that, and I'll talk about that in a little while. The focal point, which means the distance from the tissue, whether we're directly contacting the tissue or firing the laser from a distance away, has an effect. The tip initiation, which there's another little section on, affects that as well. And the speed of how you use your laser. So slower speeds mean that more energy is delivered to that site, which means a thicker, deeper incision with your laser as more tissue is affected. And the width or the size of the tip has an effect. So, excuse me, a focused beam delivers more energy than a spread out beam. So I like to use the analogy of a magnifying glass. If you use a magnifying glass and you concentrate the sunlight, you can burn through a piece of paper. So that's sort of the principle behind that. So this is just a quick bit of research that I did. As you can see, there's a whole heap of different diode lasers around, and there's probably more. And they all have different configurations. And so you can see some have a much more bulkier sort of unit that comes with it. Some are a little bit more compact. Some have foot pedals, some don't. As you can see, they all range in different wavelengths. The laser that I was using previous to this is the NV micro laser on the bottom left there. So that's at 808 nanometers, and that I'll admit it's a fairly nicely designed soft tissue laser as well. They're all fairly lightweight and portable, but the NV laser is quite nice because there's no benchtop unit. It's just the pen-like, but there is a foot pedal that goes with it. So, you guys are here to want to know about this beast here, which is the K2. And immediately you should be able to see one of the biggest advantages of this diode laser, in my opinion personally, is that that's the whole unit right there. There's no benchtop unit, there's no foot pedal. It's all compact into like a nice pen-like device. And there's a whole heap of other features for the K2, but like if you go on the website or the brochure, there's a whole heap of things that they promote, but these are the ones that I find is the most I guess clinically relevant for me after having used a different laser. And it's the most breakthrough sort of achievement that I think they have done is that they have an adjustable optic fiber, meaning that you can actually change the length of the tip of the activating tip at the end. So if you've got a very, very deep margin that you want to treat, you can extend that post, whereas other lasers, they have either disposable units or prefabricated tips, and you can't alter that that length of the tip. The head is also adjustable like to 90 degrees, and so I find that it's virtually usable in any configuration and angle that you can sort of imagine. And I certainly haven't had any issues accessing certain areas, whereas in the past with the other laser, I found that sometimes it's just there's a limitation as to how I can access the back of a distal 7, for example. The presets have most of the settings preloaded to the most ideal setting, so that's it's quite nice. You don't have to think too hard about it. You can just literally plug and play, and you won't be very far wrong. The gravity sensor, I find that's quite cool. It's like a design factor. So no matter which way you hold the laser, whether you're right-handed or left-handed, the writing on the LCD screen is the correct way up. So I just found that's it's just a nice design element. And I think nowadays in this day and age, I think when dental companies come out with products and little toys to help us with our work, I think adding that sort of touch is quite nice. The fiber cleaver is built right into the unit of the base, so you'll get to see that. I'll give you a live demonstration at the end how to use that. And from an engineering point of view, it's beyond me. I don't understand the science, but I understand that the other handheld diode lasers, it can't dissipate the heat enough, and that's why they can't compete with the power output of the K2, which is 3.5 watts for continuous modes and 6 watts at pulsed modes. And so this is what I was saying before. Sorry, the picture's not So it's a little bit pixelated, but you can see here that no matter which way you orient the device, you can clearly see the settings and the writings the correct way. And you can see the versatility of the laser with changing the angulation, and that actually goes to 90 degrees, and you can extend the length of that fiber however long you need it to be. So, from my experience, depending on how you use the laser, whether that's a pulse mode or continuous mode, the energy output and the speed you're moving it to, you can get different effects. And personally, I found that you need to play around with these different factors to find what works well for you in your hands. And I found that as dentists, we're quite familiar with a contact approach, given that most of what we do involves, a handpiece and a burr touching a tooth. So we get that tactile feedback, and the laser can be used in that same way. And that's probably why, admittedly, I haven't delved into those other sort of modes that we can use the K2 lasers, just because I'm still inexperienced in that field, but definitely contact mode is something that that comes very natural. One thing about the tips is that the diode tips, as you can see on the left here, you think that the laser beam fires out directly in a straight line, but it actually diverges 9 degrees either way, or around 20 degrees the total angle. So the further we're away from the tissue, the less intense the beam gets. But when you initiate the tip, it focuses the laser beam to more like the picture on the left, into a straight line. And there's lots of online resources like YouTube videos that show you the demonstration of how to activate the tip, but basically use a piece of cork material or articulating paper, and you're going to singe the end of the material, end of the fiber tip with either of the material, and that sort of converts the laser energy into a heat energy, and that's how you get the tip activated right at the end, rather than splaying out like a big flashlight. So in terms of the clinical tips or general principles you should follow for using the laser, I think the key is that you try to use short paintbrush-like strokes, and you want to be, keep moving fairly quickly. You don't want to just rest the tip in one area for a long period of time, and you want to make sure that you avoid tissue debris accumulating on the tip, because obviously if something's covering it, the laser beam isn't coming out as effectively. And if you notice that the tissue isn't cutting, it either means that you've got too much debris that might be stuck on the tip, so you need to wipe it with just a wet gauze, or you may need to even reinitiate the tip, so placing it on the cork or the articulating paper. If you start to see there's some white blanching or that black charring that we talked about before, that means you're either going too slow or your energy output is too high. So what we want to look for is, the tissue should still look moist, but have like a tanned look to it, but not, charcoal black. And the cool thing about the K2 laser is that it has a reusable fiber tip. So most other diode lasers, you need to buy disposable tips, so it becomes a little bit more of a hassle in terms of keeping stock of your inventory, taking up storage space. But with this, you'll find that you just need to cut off the tip periodically to make sure the optic end is working well. And then when you need to trim it off, you'll see there at the bottom of the unit, there's a built-in cleaving tool at the bottom. And it's important to note that that's not actually the instrument to cut your tip. You use it to make a little score on the actual fiber, like a little line, and then you break off the unwanted portion, and then you have a brand new tip. The manual's got obviously a detailed instructional diagram on how to do it, but I'll try and show you as a demonstration at the end as well. There's also a little stripping tool, which is the little tool on the right hand side that you use to remove the protective cladding around the actual fiber optic tip as you keep using it more and more. When you start using the laser, one of the things that you'll find is that when you cut tissue, it creates a smoke byproduct, and it's called a plume. It smells pretty bad. Smells like burnt tissue, and it can actually irritate your eyes and upper respiratory tract. And because of the smoke, obviously you can't see what you're doing. So it's important that you have, high volume suction working very close by. So you're having your assistant work closely with you, just like as you would with the high speed handpiece to catch all the water. And another reason why it's important is that the HPV, human papillomavirus, it can actually survive the combustion and remain infective in that plume of smoke. So it's important that you have the good high volume suction next to it. So hopefully you can appreciate that there are possible dangers to you and your patients and your assistant and your support staff when you're using a laser. You need to have the appropriate protective eyewear. And one thing about the eyewears is that each different wavelength, you need a different set of glasses that are protective for that particular wavelength. So if, for example, you're using the K2, which is a 980 nanometer wavelength, but your safety glasses were intended for, let's say, 810 nanometers, then you are going to damage your eyes or your patient's or your assistant's eyes. So make sure that you need to make sure that the correct safety glasses is applied for whatever laser you're using. It's also important to you have a sign on your surgery door to make sure that no one accidentally walks in during the surgery if you're using the laser and have inadvertent eye damage. And obviously the safety glasses are all supplied when you purchase the K2. I believe there's 3, so a pair for you and your assistant and one for the patient as well. One of the tips that I have is, if you have a very compliant patient, I find sometimes that I just tell them, hey, look, we're using a laser, it's damaging to your eyes, and they've already got our safety glasses on and they're happy to keep their eyes closed. That's what I have found with some of my patients, but wherever possible I do try and place the safety glasses on. So finally, I thought I'd just show you a few different cases that I've had with my sort of relatively short time using the laser. Like I said right at the start, I do use it mostly for soft tissue work around restorative work. So that's simple restorations or crowns or implants and things, exposures, and also to get hemostasis and sort of an alternative for retraction cord. I'm still sort of tweaking my workflow. Sometimes I will take an impression with just a laser around my crown margin. Sometimes I'll do a laser to help control the hemostasis and as well as use a retraction cord. So I'm still tinkering around with what works well for me. But this is a case here. Lady had an old crown on the 2-1 that she was unhappy with the recession. Just lasered around and just tried to even up the margin, and we've got a much more I guess appropriate gingival zenith and profile around there. This is a case where I show the potential of the laser. So I've lasered the mesial surface of this canine, and you can see that virtually all bleeding has stopped, and I've intentionally left the back half, and you can see how well it controls the bleeding. Yeah. This one here, deeper sort of restoration. So you can kind of imagine where the gingival line used to be, and I use the laser just to go all the way around until I expose the margin of the decay, so I can visually see where the restorations need to end. Obviously, I mean, I'm not trying to teach you how to do dentistry, but obviously an important consideration is knowing your biologic width and whether that's, whether you're encroaching in that space. Fortunately, this particular case, I told her from the start that, look, it's not looking so great because that probe was just going deeper and deeper before I lasered everything off. Unfortunately, this one had external resorption, and so the tooth, the endodontist claimed that we should remove it and plan for an alternative replacement there. Some more crown and bridge work. This is probably when I first started, and you can sort of see that more of that charring look. So either my technique was slightly too slow or my energy setting was a bit high. So you get that burnt look, and this is showing it more from an occlusal view. So you can see you actually can get quite a good I guess, physical retraction because we're sort of ablating the tissue around. So when we come to impress, you can actually see, or your technician, I should say, should be able to see the margin quite clearly. Obviously, this is a rough photo that I took mid-surgery, but we obviously clean all that up to get a nice optical impression. Some more deep margins on the upper molar, just to expose the margin to gain a better seal with a matrix band or some sort of unit to help restore the tooth or temporize the tooth. And likewise here, so this is a combination case where she had quite deep caries into proximity, but I couldn't justify breaking that distal marginal ridge, so we've kind of gone for a buccal access, but there was just a lip of tissue that was growing there, so I've lasered that off, but also placed retraction cords. So I'm not going to teach you how to do your dentistry, but you'll find that sometimes laser alone is sufficient for your needs, or sometimes you'll need a combination of both. And likewise, same again, this is actually a very, very deep margin, but a lot of times I use the laser to help me assess whether this tooth is restorable or not. And unfortunately, this one, the fracture was too oblique, and I don't think that we would have been able to seal this well enough. So he's off to get an implant with the surgeon as well. And this is probably the most, I guess, satisfying use of the laser so far, is that this is a root canal treated tooth, but she's obviously shaved off that distobuccal cusp. But I was able to actually expose, obviously, the margin completely, place Tofflemire and a combination of Tofflemire and sectional matrices, and we could actually restore this somewhat. But she knows that the tooth is not in great shape, but trying to do that conventionally, either with a scalpel or or just a burr, even, you can do that, but trying to control the bleeding is very, very difficult. I'm not sure if you guys have had similar experiences, but I mean, that to me is a very clean surgical field. Once again, probably my setting was a little bit high. I'm starting to see a bit of charring there, but you can see that it has really, really good hemostatic control. This is probably one of the most recent cases that I've done with it. On the left hand side, sorry, the image is a bit cropped, but a little operculectomy towards the distal of those eights, and that's about 6 months post-op. So I didn't have to get a scalpel out for that. I just lasered all the tissues off. I did still have to numb it, although a lot of laser proponents say that the advantage of using lasers is that you don't need local anesthetic, but I don't know, I might be a bit old school or might be a bit too soft-hearted, but I prefer to have them numb so I can work comfortably without having to worry about the patient's comfort. And you can use the laser for abscess ulcer management, and I mean, we all know that ulcers are self-limiting and they'll get better within a couple of weeks, but doing something like that, this is, I think, a 2-week or 10-day review, and that's healed up quite nicely. And there are some other examples that I don't personally use, but if you're periodontally inclined, there's a lot of research actually about low level laser therapy, and it helps clear up the pathogens in the periodontal pockets, as well as pain management. Well, that's quite an interesting paper, how using a laser actually produced better post-operative pain levels. So I mean, look, the world's your oyster. There's so many different avenues that you can take with your laser, and I'm still a student of the game. I'm still learning, but hopefully you've learnt a couple of things that might be helpful for you. So there's my details there. Feel free to send me an email or a text or a call if you have any questions. I've just give you a quick demonstration. I've got my laser unit here with me, so I think there was a group down from Invercargill who had the laser with them. So if you want to follow along, feel free to. But this is how the unit comes in. Very nice, pen style. It's very, very light. There's a few things here. So obviously we've got the battery cover at the back, and we have the cleaver at the bottom. Sorry, I've actually I was a bit naughty and I've broken the battery cover, but I need to go back and talk to John about it. Just put this back in here for now. And then we've got an aluminum cap at the front, and that comes off completely. I don't believe this is autoclavable, but I mean, I just don't find the need to. So what I actually use is I've been using a curing light cover as a sort of a protective shield over the top when I'm using it in surgery. But I believe, John, that there's a new little sleeve that you can put on the top to help prevent cross-contamination. But I find, curing light cover works just as well. When you turn on your unit there, obviously has a nice welcome sign. I'm not sure. Sorry, I apologize. It's not very great trying to show this on a webinar, but when you turn it on, you'll get a prompt for a password, and I've been told that a lot of people get confused about it, but it's just a safety mechanism for most lasers, is just to prevent kids and people who shouldn't be playing with it. So the code is actually just set as 0000. So you just need to push the button that's got the dot on the back. Sorry, I apologize. So this button here, push that 4 times, and then that'll log you into the laser. Then you come up to this screen where it says EPISO, and those stand for different modes. So you've got your endo mode, perio, implant, surgery, and other modes. I myself personally, as you saw from the case examples, I go into my surgery S mode, and I select the gingivectomy mode, and then that's our setting there, which is at 1.4 watts, and that's on manual. And that's basically how I use my laser. I haven't been brave enough to explore the other adventures, but hopefully you guys can share some feedback on how you guys are finding it. But if you cycle through, there's all the different presets there available. With the tip itself, a couple of tips. There's obviously a button that slides your fiber optic tip up and down. So how you want to load your tip, sorry, I should talk about that as well. So there's actually 2 different tips if you look. One is, I believe, 400 microns, and the other is 300. The smaller one is used for your endodontic applications, and the 400 is more for your general surgery type. So they've got a little number on there in case you're wondering how you differentiate, but on the metal barrel, there's a number that'll say 400 or 300. You want to remove the steel cover from the top, and this slider, you want to push all the way up to the top, and what you'll notice, it's a little magnetized application, and you just slot it through the gap. Sorry. And then it'll just slide on, and there'll be a magnet that holds it in place for you. And then you can withdraw the slider all the way back, and then you place your tip through here, like so. And then that now is ready to go with the laser, and you can extend that out as far wide as necessary, like I said, and you can bend this tip to whatever angle. So this is the really cool thing that I like about the laser, is that you have multiple configurations in terms of length and angles, and I think there's no other sort of handheld diode laser that actually comes close with it. I do apologize, I forgot to bring my stripping tool, because I was going to show you how to do the cladding and removing the wire, but essentially what you want to do is, you will not be able to see this, but I haven't actually stripped the protective cladding on this one yet, but the yellow instrument that you saw in the slide, you want to cut off about 3 or 4 millimeters, and that'll just expose the yellow sort of plastic covering, and then you'll be left with the fiber optic fiber in the middle. And then you want to use your little cleave tool, which is found at the bottom of the unit behind the battery cover. I'll just find that for you. So it comes off at the back here, you lift that up. So this thing here, you're not actually going to use this little sharp tool to just hack away at the fiber optic. You want to put it on a nice flat surface, and you want to just make a nice straight line. And then what you do is you grab it with 2 hands, and you grab the shorter end where you're going to cleave it off, and the other hand, and you just literally snap it like a sprig of pasta, I guess is the best way to describe it. So this tool is not a cutting tool. Some people mistake that, and you can't cut it, or you shouldn't cut it with scissors. That's going to crush the fiber optics and it's going to ruin it. So that's the sort of how to sort of change your tips. I've just had the basic 400 microns and the 300 micron tips since about August, and I haven't had to order any new ones. One of them is starting to get a little bit short now, where even if I push it as far up as you can go, it doesn't actually engage as much. But this other one here, I've still got plenty of fiber optics left there for me to last probably till the end of this year. So if we want to talk about sort of more economics of things, I think these are really fairly cheap. I don't even know how much they are. Maybe Ref or John can chime in, but they're very affordable, and as you can see, they last quite a long time. One tip that I'll probably suggest, because I'm not doing a lot of non-contact use with my lasers, I use both my general tips as cutting tips, but if you'd like to use them for the various different applications, one good thing probably is to leave one tip initiated and one tip not initiated, and then you can alternate between the two fiber optics depending on what you want to use. Because if not, if I initiate this tip and then I suddenly want to use it non-initiated, I have to cleave off a bit and start fresh again to have it non-initiated. So hopefully that makes a bit more sense if you guys start exploring those other options. But I would say probably 70% of the use as a general dentist would be to use it as a contact tip. So that's how I've been using it. But look, there's no right and wrong. If you guys have multiple clinicians like down in Invercargill, you guys could invest in just a few more tips, and every surgeon can have their own tips and they can handle it the way that they want to. So if it's initiated or non-initiated. And like I said, they're the cheapest chips, and compared to sort of competitor brands where they can get quite costly, especially as they are single use, this one is great. You can just keep using it over and over. You just autoclave it. So to take it off at the end, one tip also is to make sure you clean it really, really well, because you'll get tissue debris clogging the end, and then when you try to remove this cap, it doesn't come off cleanly. So making sure you visually inspect it, just use a bit of gauze and scrape off any tissue, and then to remove it, you want to withdraw your fiber optic all the way back, lift off the cover, extend this all the way out again, and you'll see that the little metal portion gets exposed, and you want to grab it by that point and pull out, not by the fiber optic, because this can break quite easily. So grab it by there, and it's a light pull for the magnet. This gets autoclaved in your normal 134 cycle, and the rest of this can just be wiped down with a bit of light, either alcohol or whatever sort of clinical wipes that you're using.
Any questions, Kelvin and Toothworth?
Just wondering about the extraction socket. Do you use the laser to achieve hemostasis that way?
No, I mean I'm still pretty. I'm a youngish dentist, but I'm pretty old school. I haven't used it, but I can see the application of it. If I'm being very honest, I think that I just don't know what the clinical implications would be, whether you have a huge advantage. I mean, good old gauze in a couple of minutes is probably going to take you the same amount of time to get hemostasis of an extraction socket. That's sort of my opinion, but I think there's probably going to be quite a few good advantages of using it, in terms of, like I said, there's plenty of studies out there that show that the use of laser reduces post-operative pain and swelling. So yeah, I mean, I personally haven't, but I wouldn't rule out that you can't do that. And if it works well for you, then great. Feel free to share back and teach me how you guys implement it.
Another question: have you used it to help people with cold sores at all?
Look, I personally haven't, because like I don't work full time. I work part time, and I am mostly surgery based, but I have actually seen it at multiple different laser sort of presentations, and that it can be applied that way as well. And the idea is that it reduces the obviously the symptoms, but the recovery time as well. So you can use it in that same sort of non-contact method. So like I was talking about before, if you're finding that you have quite a few patients who you'd like to help with that, it might be worthwhile having a set of tips that aren't initiated, so you can use it like that.
Do you mind showing me again how you got into the mode and all that stuff again?
The mode. Yep.
Yeah.
So when you turn fire on your machine, it'll say welcome. You push the little button with the dot on the bottom. There's an arrow key left and right and a dot. You push the dot button 4 times, and that'll get you past your PIN code, and then there'll be a little screen that says reference.
Yeah.
You just want to push the circle button again,
And
then you got EPISO. That's your different modes. So you push the circular button again, and then the E will be highlighted.
Yeah.
So that if you want to enter that menu, you push the circle button again. But if you want to go across to the side, that's when you use the arrows. So I personally go across to S, that's my surgery. And then you push the dot, and then you've got different procedures like gingivectomy, papillectomy, incision and drainage, blah, blah, blah. And so I always go to gingivectomy. This is my go-to setting. Push the circular button again, that's like the set button. And then you've got your standard and gentle mode. So standard is more of like a continuous mode, and gentle is like a pulse. I find continuous, I don't know, it just works well for me, and I haven't felt the need to change. So I click on standard. That's ready to go. But what you'll notice is you actually have to push down the circular button, and then the front part here lights up. That means that the laser is ready to go.
right. Oh, okay.
Yeah, so, and when you're done with that, you just push the circular dot again, and then the light turns off. So I'll try and show that on the screen. If I hold down the circular button, that's ready to go. Once you've finished your lasering, push it again and it turns off. So once you've primed it, this is ready to go. This button here is what actually dissipates the energy of the laser, this little circular button here. So you use it like a pen, and you push down on this button, and you do your lasering, and then you push the circular button, and that uncharges it.
Cool.
Yeah, and yeah, feel free to have a look around, because there's lots of cool little, well, I'm sorry, John and Raf, but a few gimmicky things that I haven't had times to explore. But I think, if like technology, I think if used well, it's probably comes in quite handy, but I just haven't felt the need to use it yet. But there's automatic emission mode. So if you're having to laser off a whole, I don't know, 6 to 6 or something, it can get quite tiring holding your finger down. But there's an automatic emission mode where it's just constantly firing, and you don't have to hold anything, and you can just hold the laser, and it does everything. But my usage is fairly short around a particular tooth, so I haven't found the need for that yet. But feel free to explore around. And then also, once you're in there, I'll just go back to the setting for you. So if we go back into this, and you want to say, for example, change the power outage during it, when you've got that setting on, you just tap the circular button once, and then the power 1.4 watt is blinking. And then you can use your arrow keys to go higher or lower. You don't have to sort of go back and reset everything else. But yeah, so that's a way to sort of adjust things. And then you can change also your pulsed modes or your manual modes as well by cycling through. So yeah, I mean, get familiar with it. I still sometimes get the buttons wrong, but there's basically a left and right or up and down button, and the circular button is the select button. So yeah, you'll get used to sort of maneuvering around.
Sorry, how do you get out of the mode? Say if I mispress something and we get into.
How do you go back?
How do you go back? Yep, the back button is, I believe, is the first arrow. So if you hold that down, it'll take you back one screen.
Oh,
Yeah.
Yeah.
Big move.
So that goes back to the previous one that you have, and you can change the, like I turn down the voice because I find it gets a bit annoying, but you can turn down the volumes and things and the beeping and whatnot. But yeah, there's a lot of cool things that you can do with it. But just like anything, you just need to sit down and play around with it. I mean, I just literally sat here and played through every single button, but I found that I don't need to use all of them. But when I first got it, I definitely went through and just played with all the buttons. So yeah. Oh, and I think one important thing as well is with the batteries. I found that with one battery, I think it would sometimes last me like a month before I needed to recharge anything, because you're using it for such short exposures anyway, right? But one problem that I found, which was partly my mistake, is I left the spare batteries in the charger 24/7 in my surgery, and I think that sort of dissipated the battery life. So I just recently replaced those with John, but I think that sort of fixed the issue. But once they're fully charged once, then just keep them aside in a separate, cool cupboard drawer. And then, like I said, I don't think you actually need to, you'll find that you don't need to replace the batteries very often, because it's quite friendly in terms of usage. But that also obviously depends on how much laser use you're using. If you're using it every single patient and everyone's using it, then yeah, you're going to cook through those batteries, so you might need a few backups. But great thing about this, like the consumables, is that everything's quite affordable and cheap, and I believe it comes with 2 spare batteries anyway when you first purchase it. So yeah, I haven't had to constantly recharge the batteries or anything like that. I feel a bit sorry, because I'm not a laser expert. I'm just a general dentist, but I mean, it's I don't get endorsed by John or Raf to talk about this, but I just really like it as a product. That's why I said yes, I'll give this talk, because I'm not a professional speaker. I'm not on a speaking circuit, but I just genuinely have a really good time using this product, and I think the more people know about it, the better, and the better care that the patient's going to get.
All right. Okay, have a good night, everyone. Thank you.
Cheers. See you guys later.
See you. Bye-bye.
Bye.